In our Health Watch report, patients with certain heart conditions used to rely on medication first to bring the heart back into rhythm. Now there's a faster path to health. Local 3's Connie Fellman has more.
Every year, atrial fibrillation, known as AFib or AF, contributes to the deaths of about 158,000 Americans. It's a condition where the heartbeat is irregular and blood doesn't flow well through the heart chambers. Medication has been traditionally the first treatment doctors recommend, but now the expanded use of a cold ablation procedure is increasing options. Patients with atrial fibrillation may have no symptoms at all. Some may feel a fluttering in their chest or be out of breath and fatigued. Over time, the episodes can be more frequent and last longer.
The biggest issue, though, is that in the atrium, because it's really not pumping, it's just quivering, blood can stagnate and cause a clot, and that can cause a stroke.
In a recent clinical trial, doctors studied the use of a technique called cryoablation as a first-line treatment before medication. During the procedure, doctors used a catheter with a balloon to reach the upper left chamber of the heart and then used cold energy to ablate cells and block abnormal electrical signals causing the arrhythmia.
Close to 75% of those who had the ablation maintained sinus rhythm, and they felt so much better. So their quality of life was much better, versus 45%, only 45% in the drug arm.
As a result, the FDA expanded the use of the Arctic Front cryoablation system to treat patients with recurrent AFib.
We can offer them an ablation sooner than later, and they won't have to deal with the medications and their side effects, and also the risk of progression of atrial fibrillation,
lowering the risk of other health complications. The system was tested as a first-line treatment in 3 separate trials, 2 in the U.S. and 1 in Latin America, Europe, and Australia. The results of all 3 trials supported the use of cryoablation for patients who have had a sudden increase or recurrent AF. And that's your Health Watch. I'm Connie Fellman, Local 3 News.